Today morning, Kampala Capital City Authority KCCA councillors, together with the Uganda National Consumers Health Organization, a civil society organization that advocates for a free tobacco Uganda, have carried out a sensitization campaign in Kalere over the new law, the Tobacco Control Act 2015, especially about some provisions in the law that people of Kalere need to understand better to avoid breakage of the law. Some of the provisions in the law state no smoking in public places, where for someone to smoke needs to move away 50 meters from the public. No smoking shisha, and that a child below 21 years should not participate in any tobacco activity, whether it's growing, advertising, or displaying its products. Speaking to journalists in Kalere, Councillor Michael Zwawamala of Kawempe South said that government should put much emphasis in implementing the law because many people have continued to die as a result of tobacco consumption.
They were not consuming cigarettes as cigarettes. They were consuming something called a mindi, that windpipe. There is that windpipe, but they also put in tobacco. Locally, harvested tobacco from the garden is here, which is also equally dangerous and very, very, very harmful to the area. So we call upon the government to stop thinking about collecting taxes from tobacco and these companies that are manufacturing it. Let them think about the lives of the citizens that they are leading before they think of the money that they're even getting out of it. Because at the end of the day, the government is actually spending more in treating these patients when they get cancer, more than the money they collect in taxes.
Councillor Segirinya Mohammed said that it's the responsibility of the leaders at all levels to ensure that they sensitize the ordinary people about the Tobacco Control Act 2015 because many have remained ignorant about the law.
Because it's quite unfair. The government has failed to come up to tell people the consequences and the effects of smoking. So if the government cannot tell people about the consequences and the effects of smoking, so we as leaders tell our people. That's why we are mobilizing our people that we should ban the smoking in our country, Uganda. We as KCCA.
Meanwhile, the legal officer of Uganda National Consumers Health Organization, Moses Talibita, said that the best way to implement the Tobacco Control Act 2015 is to ensure that every Ugandan becomes part of the sensitization campaign over the law, especially politicians.
Abomubutale bagobe omuntu yenna afuweta sigala kumpi nabo. Ekyokubiri twagala bo bennyini banoonyereze ebifo ebyo byonna we batundira sigala nga bamulabisa babikube muki mu bannamateeka. Ekyokusatu baleme kukkiriza omuntu yenna atunda kubba kubanga amutunda kubanga abaana abato bakoseddwa nnyo ku bono.
Story compiled by Julius Mohomoza for Dream TV.